Okay. Hello, everybody. It's Menopause Made Easy with Tanya, and I'm bringing back Nicole this week because we got off the podcast last week and we started talking about douching and vaginas and microbiome. And I'm like, there is so much confusion. There is like things that women need to understand to really help them. And we talked a little bit more about UTIs. So, Nicole, welcome back. We're going to jump into your passion as a doctor to really help women through, navigating the landscape of UTIs, vagina problems, all of this kind of stuff. And again, you offer some beautiful products that are safe and affordable to women. And so you've really stepped into this place of like, I need to help women. So welcome back. And here we
Thank
go.
you so much for having me again. And yes, this is my passion.
Yes. So before we hit record, and then I'm like, okay, we just got to hit record. I said to Nicole, okay, you're a doctor. Why did you branch out to create a product to help women? So give your example again of, this woman that came in. Take it away.
Okay. So, I it was really triggered for me when I was seeing a young patient who had breast cancer, who estrogen products were off the table for her, and she was having extreme pain with sex to the point where she really couldn't have sex anymore. And I said to her, what's really exciting is that there's these new hyaluronic acid suppositories available, and they are almost as efficacious as estrogen. So you can start using these twice a week, just like you do moisturizer anywhere else in your body. You're going to do this. We're going to get you hooked up with physical therapy. We're going to get you back. And so I'm so excited that there's something we can do for her. And I go out of her room. She gets changed. I go back into her room. She opens up the suppositories I've recommended to her on her phone, and they were $80 a month at the time. And she says, I can't afford that. And I just felt like that's ridiculous. There's hyaluronic acid in literally everything. It's the
Mhm.
best moisturizing agent we have. We use it on our skin everywhere. And I wanted to do something about it. I wanted, instead of then just saying to her, okay, well, sorry about that. I guess you have to use the stuff that doesn't work as well, because I didn't have an option for her. And it was that just made me like, okay, there are things I know that work well in the vagina. Hyaluronic acid, coconut oil. That's something that, it's a natural substance that we know is an effective moisturizer. And so I wanted to put things together and make it accessible so that women could walk into a store and pick something up and know it's safe and it's actually going to work and not hurt them. And I happened to go out to dinner with a dear friend who also happened to be the former CEO of Burt's Bees. And I was telling him, I'm so sick of it. I really want to do this. I want to make something that women can go out and buy. And that night he didn't say to me, "Oh, let's do this." But the next week he sent me a text and said, "Do you want to talk to some of my friends about your idea?" And the friends was the former research and development team from Burt's Bees. And so they listened. And these are these amazing scientists who know how to put these things together, who've had the
Mhm.
experience. It's like a well-oiled machine. They have done all of this before. They knew how to get the right ingredients, the right people to manufacture the products. And that's how it began.
Nice. See? That's beautiful because you have like you're in an environment where you are seeing things over and over and over and over again. And then there's this level of frustration because either the products are too expensive for women to care for themselves or they're not they don't have the best ingredients in them. Let's just say. Okay, now so
Right.
somebody listening to this, they go, "Well, why don't I just slap some coconut oil?" And it's not your vagina. It is what is it the lapia? Like, oh my gosh. I see I have unless once upon a time I knew all the parts.
That's okay.
And
This
now
just
I
is,
don't.
that's okay. You don't need, I mean, you are a representative of all women,
Yeah,
right? This is, most women don't know, and it's okay. Like, that's why we're here talking about it.
yeah.
But
Because I think, is it
yeah,
called your labia?
labia. Yeah.
Yes.
So we have labia minora, labia majora. The vagina is inside. Most women just refer to the vagina as the whole area, right?
Right.
But
Okay. For simplicity, we'll just do that. So,
okay. Well,
unless there's something that you need to
I
pick
know
apart.
I'm gonna start using some other words, but I can't help myself. So yeah, I mean, coconut oil, I used to tell women to use it quite frequently, especially breast cancer survivors before we had any of these other alternatives. The problem with it is it actually has really great antibacterial properties, but it's almost too strong so that it also kills your good bacteria, which is
Ah,
why you can end up with some more infections if you use it like just pure coconut oil. Now, when we formulated the Alubri products, we worked together with, he's actually a former NASA scientist that helped us use these activated oils, and they break down the oils. And when we were formulating the products, what we ended up being able to do was not just work on the moisture, but was to also help the microbiome, which is a whole nother piece to all of this. And if you break down these natural oils, what we used in our products was coconut oil and rosehip oil. We could target the bad bacteria and promote the good bacteria. So lactobacillus is the good stuff, and Gardnerella, Provotella. There's a few bad actors that cause odor and irritation in the vagina, and we were able to use that coconut oil broken down to promote that lactobacillus and kill the Gardnerella. But
okay.
straight up coconut oil is almost too strong.
Okay. And
But
so this is really interesting to know, right? Because some people would take our conversation and go, oh, I'm just going to go and buy a big tub of coconut oil and just slap it on there, right? So
yeah,
it's
I mean, it's
really,
not like the worst thing in the world. You could
yeah,
do worse things.
yes,
You could do worse than coconut oil, but it's messy and it can increase that bad bacteria if you aren't using it. I mean, it could for some people.
right. Okay.
Mhm.
So there's this balance as everything that we do, right? And so
Yes.
you found this formula or helped them with it that, and see, this is the thing, everybody, is that it can be so overwhelming. You go to the drugstore or the pharmacy, whatever, and it's just like there's 10 products. And how do you make a decision, right?
Yes.
How do you decide which product is better? Are you buying for price only? Are you actually looking at the ingredients? Do you understand how the ingredients affect your inside? So I'm not going to, bring up any brands that aren't great because I don't even know them anyway. But just for somebody, talk about why. I mean, you just did a little bit, but when they look at your label, what are some like reasons that that is the right choice for them?
Yeah. So I think one way for you to approach a shelf, when I walk up to a shelf, what I want them to eliminate, obviously I would love for them to look at my products, Alubri, and say, yes, that's safe. That's the one I want. But if Alubri is not there and they just have a selection in front of them, how are they choosing? Look for things. If they have fragrance, that's an automatic no. I
Okay.
mean, if it says, vanilla, if it says some kind of floral, something, no, you don't need any fragrance there. That's an automatic no, because those are the things that are disruptors to the microbiome. Like your vagina is not supposed to smell like flowers. Your vagina is not supposed to smell like vanilla or cookies or anything else.
Oh my
It's
God.
it's supposed to smell like a vagina.
Yeah.
Yeah.
Huh, is somebody making chocolate chip cookies? No, that's
There
just
are
my
some,
vagina.
yes. So as soon as you see those things, it's like just that's not it. You want things that are targeted to keep your pH normal. So, you want things that are paraben free, products that don't have glycerin. Those are the things that are what you are looking for that are going inside your vagina.
Yeah. Okay. So then you have four products, which we're going to talk about, but what is the difference again between somebody who needs like the estrogen, the vaginal estrogen versus Alubri?
Okay. So, I mean, I think of there used to be a little chalkboard that had, or I don't even know what, a little letterboard that the residents I worked with would put up little quotes from the doctors, and my quote was, "Every woman deserves vaginal estrogen." And I still believe that a lot of women do benefit from having estrogen after menopause, the genitourinary syndrome of menopause. And I think we talked about this a little bit
Yep.
last time, is it gets progressively worse as we age. And so it causes dryness, irritation, discomfort, even sometimes just kind of sitting, let alone, sexual activity. And UTIs are the other big
Yeah.
reason. So, but when you think about using vaginal estrogen, some women are less comfortable with it if they have a history of breast cancer that's estrogen receptor positive. There's been good data to show that it's still safe, but there are going to be people who still would rather not put estrogen in their body if they have an estrogen receptor cancer. And I understand that as well. So there are also women who can use estrogen and still don't get relief. So I have patients who are using their vaginal estrogen twice a week and they still have dryness, or they're still getting UTIs and they still have that discomfort. Those are the patients who Alubri is going to be a great adjunct for them. So when you're using vaginal estrogen, and this sounds like a lot, like, oh my God, every night I have to put something in my vagina, but it's almost like I think women should think about do vaginal care as skin care or whatever else you do for your body before you go to sleep. And your regimen kind of changes from the time that you're 20 to the time that you're, or at least for me, being 54, it takes a little longer to go to sleep at night. I'm like throwing cream on and putting in a night guard for my grinding teeth. I mean, I'm just like, I don't know. Yeah, there's also some stuff going in the vagina, and it's just part of the routine. So if you are using a systemic hormone therapy, you can use Alubri twice a week. That's the moisturizing gel. If you're using vaginal estrogen, you can use Alubri on the alternate days. So if you're doing like Monday, Thursday vaginal estrogen, you do Tuesday, Friday Alubri. The other nice thing about Alubri is you don't have to, if you use that moisturizing gel before sex, it's not going to affect anything.
Okay. Okay. So now, I'm just like, okay, let's talk about douching first, and then we'll come back to the other products. So I don't douche. I mean, I think I don't remember. I think we stopped recording at this point, but we were talking about douching afterwards, and I'm like, I think the last time I douched, I was like 17.
Good.
Because oh my
Yeah.
God, the yeast infect the things I didn't know, like the I had insane yeast infections because my diet was predominantly sugar.
Yeah.
Like it was not a good. And you know what? I honestly, nobody talked about diet back then. Nobody talked about nutrition. Nobody talked about like the underwear. Maybe they said like I don't remember. So anyway, it does get a little smelly. And I'm like, you want to cover it up because it's embarrassing. So
Right.
that was about when I was 17 or something. But then I that was the end of that. But I don't know, is the douching market huge? Like
Yes.
are a lot
So
of people douching?
on my Oh My Gyno page, I had like, let's start a campaign, stop the douche. Like we need douches in our, no douches in our life in any form. Like no, say no to the douche. And they still are the number one selling item in the feminine care market. So I just think like I would love to get that education out there. And I understand what's happening is that people do have an odor, they have a little irritation. I think, okay, I'm going to just wash that out. But what ends up happening is you're washing out the good bacteria and the bad bacteria, and it just makes the problem worse.
Yeah.
So you want to kill lactobacillus, that good guy that's like doing all the work in your vagina, you douche, and that is just going to ruin everything. So Never, there is no need to douche. The vagina is a self-cleaning organ. It does not need anything up there to clean it out. So always think about like not sticking anything with fragrance, no douching, especially the douches. I mean, there's no good douche, but like that have like floral scents and stuff. I mean, it just is like you are going to get the opposite. Whatever happens, that is going to just knock out the good stuff. And it increases your risk because of that. Those lactobacillus are not only they're protective in so many ways, but it even increases your risk for sexually transmitted infections. So
Mm.
the CDC even recommends against douching because of that increased risk for sexually transmitted infections when you are douching.
Okay, so let's back this up. So if somebody's like, "Oh, geez, my vagina smells," like that's to me, it's a sign of something is happening at a deeper root cause. And so what
Yes.
we're doing is we're basically taking a symptom and we're just trying to put some nice smelling stuff on it without really addressing the issue. What's the issue?
That's exactly right. So it's usually, and of course, I would always encourage women if they are worried about like there's an odor, there's irritation, and they're not sure what's going on, go see your gynecologist because we'll take a look and figure it out. But a lot of the time, it's an overgrowth of Gardnerella or that bad bacteria and not having enough lactobacillus there. So, or BV, which is the most common cause of vaginitis.
Okay, so basically what's happening is you have this smell, you douche, it kills the good bacteria, and then now you're throwing off the balance even more, so you're actually
Mhm.
perpetuating a bigger problem and it just
It'll
keep
keep
it keeps
going.
going.
Yep.
And does it affect the microbiome of your gut like everywhere else, or does it stay
So the
localized?
gut and the vagina, it's not like we have a good understanding, or at least I don't have a good understanding of how exactly the gut and the vagina are linked. They certainly are. There is some link, right? Because of things, the proximity of the rectum and the vagina, but it's not as much as like when you think about the the areas and the microbiomes that are really totally attached. Like we forever have thought that the bladder is sterile, that there's no bacteria there. We now know the bladder has its own microbiome and it mirrors the microbiome of the vagina. And
Mm.
again, we want lactobacillus to be dominant there. That protects against UTIs.
Okay. So how do we get more lactobacillus? Because I was actually just listening to some microbiome researchers and they just said that we are losing microbiome in our body just because our diets are becoming very mono. We're not getting the diversity anymore. We're not, in nature like we used to be. And that
Right.
your microbiome can change. Like if I'm here and I could go and say I moved to the city for 6 months, like my microbiome can change just because of the environment that I'm in. So like how do you have any ideas on like how do we get more of the good bacteria in the vagina?
Right. So the interesting stuff with the vagina, and of course I'm always going to promote like all of the stuff that you talk about, the healthy diet. I mean, all you want a colorful diet, right? We need that for gut, but that's obviously not my area of expertise.
Yeah.
But for the vagina, I mean, a higher estrogen state keeps a
Ah,
healthier microbiome. Avoiding things like douches or any fragrance products. And I'm just thinking about other things like other things that can knock it off. Antibiotics, anytime we have to take an antibiotic, and then using products like obviously I have my bias towards my products, but Alubri is going to help keep that healthy microbiome. So I think of these products for menopause and perimenopause, but especially our external products like we have a vulva balm for the outside. I think is lovely for people who struggle with recurrent yeast infections and BV, like over the summer when you're in your wet bathing suits and you're exercising or and can't get changed into clothes, dry clothes really quickly. Putting that on as a barrier with that microbiome benefit can be really helpful. So I know a lot of younger people have really benefited from using it in that way.
Okay, so that's the balm,
That's
which is really interesting, like BALM, right? Balm.
yes,
Okay,
yes,
balm. And I know as a personal trainer, I basically I can remember this when I started training. I would be sweating with people, but I'd be in the same like whatever
right,
material I was in all day
all
long,
day.
and
Yes,
I was itchy. Like it
yes.
was painful.
Yes.
So,
So
yeah.
that is like the perfect use for you put this on in the morning. It's just going to help with that all day long.
Okay. So that's the
Hmm.
Alubri balm. Okay, and
Yep.
then so we've talked about the Alubri cream, which is the hyaluronic acid coconut oil combination, and then the
Yes.
balm, and then what else can people do for their vaginas?
So the other, what else can people do for their vaginas? So many things. Yeah. So no, the intimate serum is a essentially a personal lubricant. So can be used, it's made for the woman. A lot of these products are made kind of more for men. This is made for for use on the woman's vulva and vagina. So like the external areas and just gently on the inside. And this is made with inulin, which is like chicory root, and it
Hmm.
is a prebiotic essentially. So it feeds lactobacillus. So it's essentially a water base. It also has the hyaluronic acid. And so you can use that before activity as an additional. What we've been talking about is moisturizers, like part of your daily or weekly routines in life. This is more of an activity based
Okay.
product. So you use that before
So if
activity.
you're having dryness,
Yes.
yes, you would put this nice lubricant in there and it would
Yes. Make
create
things
some
more
magic.
comfortable. Yes.
Okay.
And I think for me, we may have touched on this. And of course, like I'm always like, okay, am I really talking about this on a podcast? But I am. I've done it with my patients for years. Like I overshare maybe, but I am on hormone therapy and I didn't know that I had dryness because I didn't think I had that issue. But when I started using products like even the intimate serum, I was like, oh wow, I that's great. It
Yeah.
can feel better,
Doesn't feel like
because
sandpaper burn.
yes, like I didn't really, I mean, I've been talking about this since I was 25, right? But I didn't, it's kind of amazing. Like, oh, I didn't know that I needed that, but it's nicer. And
Okay.
it's interesting talking or looking at studies even about sexual wellness and sexual health that when you talk to young women versus young men about sex, men are talking about their ability to orgasm, and women are talking about whether it hurt or not. And
Mm,
so we probably should be using these types of personal lubricants even younger.
yeah.
Um, if that's an issue, or even if you aren't knowing that that's an issue, something you should try to see if things feel more comfortable.
Yeah. Very good. Good point. And then what's the last one?
The calming cream, and this
Calming.
one calming,
Calming.
calming.
When your vagina, it needs some calming.
It needs some calming. It's a little bit mad. So it's got 0.25% hydrocortisone in it. That's kind of the anti-itch. So this would be when you don't have an infection, but you have a little irritation. And I find this often when patients come in and they've used a soap or they've used something that they're having a little bit of a reaction to, and there's a little itching. But it's almost like it's it's not quite an infection, but they just need something to feel comfortable again. And that is what that's made for. There's also a lot of women who have, skin conditions. You can get all kinds of dermatitis, like wherever anything you have in other areas of your body. For instance, or even things like there's a condition called lichen sclerosis that affects a lot of women. And you have to use high potency steroids. You can only use those twice a week.
Mm,
And so those in between days can be pretty rough with itchiness in that area, which is really bothersome, right? Like no one wants to be thinking about their vagina when you don't want to be thinking about your
yeah.
vagina.
Oh,
So
well, I
this
love
is
what you said last year or last week. Like you shouldn't feel it and you shouldn't smell it,
yeah,
right? Like it's really that simple. And when you
yes,
can feel it, because listen, I've had my issues and and there's sometimes there's embarrassment, sometimes there's depending on, like I said, you walk in there, it's overwhelming. I mean, I remember just sticking ice cubes up there, just something, just to
I,
numb the
yes,
itchy irritation. I mean, it's like I want to scratch it out of my
yes.
body. It was
Yep, I
so
have had ice cubes
painful.
myself. I know exactly that. And I've seen patients, like, I know that's so awful.
It's so
Um,
awful.
it's so awful. Yes.
Yeah.
So,
And so you're like, what do I do? Right? And
yes.
I'm like, you know, so and you know what? I don't even remember what I did because, well, besides the ice cubes, but like
Oh, hopefully you saw your
I,
doctor and maybe they helped you. I don't know.
I don't know. I don't. I just remember I was in so much acute pain. I just need
Yes.
to numb myself, and
Well,
I've never been like a medication person, so I
yes,
probably honestly didn't even go to the
you didn't.
drugstore.
Yeah.
And when I do go to the drugstore, I'm like, I don't even know what to get. So then I don't get anything because I'm like, I don't want to make the wrong choice. So
Oh,
I
yeah.
get, I
Yes.
get like this whole thing.
Yes.
Um, yeah. Oh, that's
Well,
crazy.
my ice cube story was, and I hear this all the time from patients, and it was before I was a gynecologist, but it was using like a 1 day treatment for yeast. Like you think you're going to just knock that out with that 1 day treatment, but so many people have a really bad reaction to that because
Mm,
you can't do it in 1 day. You're going to
mm,
just set yourself on fire.
yeah.
It's bad.
Yeah. Oh
Yeah.
gosh. So, okay, so what I'm understanding is like if you're a postman, well, even like estrogen, fluctuations going through perimenopause and stuff like that. Like I remember more vaginal issues in my 20s and 30s, less so in my 40s. Um, but everybody's different. I'm just thinking on my own experience. Um, but yeah, with estrogen, you're saying like I can definitely see my labia are not like they were when I was a teenager, right?
Yes, they
Um,
change.
yeah, they just there's no puffiness anymore. Um, and so that is like some loss of estrogen in there. That's
Yes.
yeah.
So estrogen cream helps that.
And
And
why do I want more puffiness in there? Why do I
this
want them fuller?
it also has to do with sensation. So there's more sensation when there's more fullness there.
Okay.
Um, and so that is part of how things feel, during intimacy. Um, but I mean, it's if you're not having that problem, you also don't have to worry about it. It's like
Mm-hmm.
it's okay.
Okay. Yeah, I can't say I've done much for my vagina lately. So it's definitely it's I don't feel it and I don't smell it. So I guess
Well, so I would say then you're doing okay.
I'm getting hot. I gotta take my shirt off. Um, yeah, but like you said, maybe I would feel, like just maybe just noticing a difference. I will pay a little more attention. So,
I
okay.
I mean, I would love to send you some stuff and have you try it, and then you might say like, "Oh, wait, that
Yeah.
actually that's good." You know,
Yeah. Yeah, because sometimes you don't know until you know,
you
right?
don't know until yeah,
Yeah.
you try it
So
out.
UTIs, like I do remember having a couple of UTIs, and I mean the thing that I remember is that basically I'm prescribed antibiotics.
Yes, that's
Okay.
true.
Is that the
Yes,
only thing that gets rid of them? And
that
there's some
really.
people, women I talk to that do have to do multiple rounds. So my question is that the only thing that fix them? And I'm more prevention. Like I don't want them. So what do I need
Yes.
to do to not get them?
So the proven thing is vaginal estrogen, we know will decrease the risk for UTIs in our perimenopausal and menopausal patients. No
Okay.
question.
So
Okay.
now, if I don't have any problems right now, should I just start to avoid, or do I wait until something happens and then do the vaginal estrogen?
I mean, it's up to you if you how you're feeling, right? Like
Okay.
not everybody has to do it. And if you're doing systemic estrogen, you don't necessarily need to add that in,
Okay.
right? Like sometimes that's enough. the obvious things I always talk to patients about is emptying your bladder before and after intercourse, making sure that you're drinking enough water, making sure that you empty your bladder enough during the day, not holding your urine forever. There is a supplement that I love that has good evidence behind it, and it's called D-mannose, and that is a sugar that the bacteria in the bladder love. So they eat it up and you pee it out. And that can be really helpful. That's something that you take on a daily basis. And that's great for people who struggle with those recurrent UTIs. Um, and then, just if you are somebody who gets recurrent UTIs, especially, and you're already doing these things, there are sometimes where we use a prophylactic antibiotic where, you take an antibiotic every time you have intercourse, postcoital prophylaxis, which that's probably like in your brain, you're like, what? And it's not great, right?
Yeah.
It's not the best. There's another thing called Hiprex, which is it's essentially like sterilizing the bladder for patients who struggle with this. But this is one of the other things about Alubri that I am so excited about. And I can't come out and say like, oh, we prevent UTIs because we don't have evidence for that yet. But we do have evidence that we change the microbiome. And I know if I
Mhm.
have a predominance of lactobacillus in the vagina, I know that my lactobacillus is going to be predominant in the bladder, and that is going to be protective.
Hmm.
And, anecdotally, I've seen really great things happening for people who struggle with recurrent UTIs, which
Yeah, because it's
happen to
an
be
issue.
one.
I have a lot of clients and well, I mean, when they speak to me, I mean, they do speak to me. What am I saying?
Yes.
I have clients and friends who these, and you know what? I have to say that some of them are not on estrogen because they're more in their 60s and 70s when this whole thing that we talked about last week,
Yes.
right, came out. So they are definitely not taking estrogen.
Yes.
And they are having higher reoccurrences of UTIs. And
Yes.
it's painful.
Yes, they're terrible. That's like another, people feel like they're getting knives, that's the
Yeah.
common description, knives. Um, so, but they still, I mean, even, you're never too old to use vaginal estrogen. Like it's never too late to start that. And again, that's another plug I would say to use these types of products.
Yeah. So for those women, because one in particular had breast cancer, and I know she still has some, and I don't think she was ever on estrogen. And even though I told her about the estrogen vaginal cream and how it just stays localized, and even her
Mhm.
doctor said that, I'm not sure if she's using it or not, because fear is a really strong motivator.
It is.
Yeah. But
I
they
mean,
could
I get
use,
it,
yeah,
right? Like, I think in my brain, I understand how it would feel uncomfortable, like putting a tube that says estrogen on it.
yeah,
Like,
yeah.
I understand how that could feel wrong, even though we know that it's okay.
Yeah. Okay, so
So,
then that would be the Alubri, like
the moisturizing gel.
the moisturizing gel. So that has
Yes.
the okay, so that's going to help bring that good bacteria,
Bring
calm
that
the
good
bad
bacteria in.
bacteria,
Yep.
help with the bladder, and then
Yep.
that's going to
I mean,
reduce.
for somebody like that, I would want them to use the moisturizing gel, and like the externally they could use the balm too, because just get all good, because that also has the microbiome benefits.
Okay.
Get the
Okay.
good bacteria flowing.
That's very helpful information. Anything else we should know about vaginal health or anything we missed, anything you see? I mean, I don't know what else happens. So I can put my sweater back on now. We've gone over the
Um, yeah, no, I think walk away from the fragrances.
yeah, that's even in skincare, everybody, because I always say what
Yep.
you put on your skin, it goes into your body. It's like if you can't eat your skincare, don't be using it. And
Yes.
and you know what a lot of products have done, and again, this is why it can be confusing, is that I'm all like on the front of the box. Like I can just remember at my dad's house, it's like, aloe vera shampoo. And like everybody's all over aloe vera, it's natural. You turn it over, there's no aloe vera in the thing. Or it's at the very bottom, and it might be like, you know, it's just you really have to flip things over and look at the label on the back and not be you know, sold what's on the front. But the other
Yes.
thing is, this is why I like having you on, Nicole, is that you can still go in and not know what you're looking for. Like
Right.
you just don't know. So the things that you said today, like no fragrance, no parabens, if you know, the easiest thing, everybody, if it says that, you just put it back on the shelf.
Yeah.
So
That's not it.
yeah,
Not what you're looking for. Put the
not what
douche
you're looking.
down.
Put
Put
the
the douche
douche
down.
down.
If we
Oh, I
get
know.
nothing else done today, put the douche down.
Oh my gosh. Okay, that's good. All right. So we covered um the great products you have. We covered how we can help women with UTIs. We talked a lot about estrogen, estrogen cream. Do you see a lot of yeast infections? Like, if you have yeast infections, does that mean you're higher chance of UTI, or are they completely separate?
They are completely separate. I mean, you can see women who have yeast with some urinary complaints, but
Okay.
it's not truly, that's not a UTI. You know,
Okay.
if you treat the yeast, it'll take care of it.
Okay.
And yeast too, I mean, it's can be so bothersome to people, but a lot of times it's lifestyle things like you recognized what you like your diet, the changing of your clothes. I encourage women not to wear anything at night, that air getting to that area, especially because yeast and bacteria really love that like dark moisture. So just wearing cotton, taking off wet bathing suits or clothes that you've worked out in as quickly as possible, getting air to that area, especially if you're somebody who struggles with these recurrent type infections. It makes a huge difference. You know, washing that area with you don't need any soap, anything inside the vagina. Nothing. Water only. You know,
Hmm.
externally, if you want to use a gentle soap, something that won't disrupt your pH, that's fine, but you really don't need much down there. I mean, you shower, you can rinse that area or bathe, but and then pat dry. That's it.
Yeah. I think if anybody gets anything out of this, like going back to the douching, is like you are really creating a major imbalance. The more you keep doing this, you are perpetual. So how do you like um I'm trying to make this funny, but how do you what's the word? Um get yourself like off the douching. Like if you stop all of a sudden, is that too much? Do you have to like if you're doing it every day, go to 4 days? Like do you need to, when you're trying to stop drinking or stop eating so much sugar, like should you titrate yourself down or can you just
Yeah,
go bang and stop?
go bang. I mean, I think people that are douching regularly, I find that most women that are douching, at least that are sharing with me that they're douching, it's happening maybe after their periods. I really don't even know.
Okay.
Maybe because I'm judgy McJudgers when they start talking about them. I'm like, no. And then they're not really even sharing with me why they're douching. I don't know exactly. I don't know what's happening. I can't believe how they sell. I don't know.
Okay.
But what I would recommend is just stop it. Just stop
Okay.
it. And I think you're going to feel better. It's going to maybe feel weird for you to stop doing it if it's
Yeah.
something that's been part of your life, but just give it a try. Like
Yeah.
give yourself a month without doing it and see what happens.
Yeah, and then maybe use your cream just to like kind of restore some of
The
um
better stuff.
the better stuff that comes
Yes.
in there.
You
Yeah.
know, I am also before I was had this, I was a proponent, and I know it's not available outside of, I don't know if Canada allows boric acid.
I don't know.
You're like, I don't know. Boric acid suppositories, because they're very unsafe if you take them orally. So I'm always afraid of anyone having small children or animals that could get into them. But because it makes the vagina acidic, the yeast and BV can't overgrow, right?
Okay.
So if somebody is prone to like, they really don't like the odor they have at the end of their cycle, I'll tell them use a boric acid suppository at the end of your cycle. It'll make the vagina more acidic, and then you hopefully can avoid that kind of overgrowth, or help your vagina get the pH back, to avoid that. So that's something that's available. People get them on Amazon or in Walmart, Target.
Okay. All right. Well, that's been very educational. It's amazing how we're just not taught
I
so much
know.
about our bodies and, you know, and misled and really
Yeah.
understanding like I go back to root cause. And again, I'm so much about prevention because I listen to these women with reoccurring UTIs and I'm like, and I don't, I'm just going to ask this, maybe you know, maybe you don't know, but is there any correlation to mental decline in UTI or anything like that?
So not necessarily mental decline, but there is, I mean, UTI can be very serious. Like as we get older, urosepsis is one of our leading causes of death. So
Okay.
that's why, it's important for us to really be on top of that.
Okay.
And I mean, certainly when people are not able to, some of the issues with UTIs is it's if you're not able to clean that area and you're exposed to E. coli and other organisms getting up to the urethra, which
Okay.
can happen with mental decline.
Okay. Yeah, because I've heard some things like that. I haven't dug deeper into that, but I also know because I had Amy on here and she was talking about her mother who had Alzheimer's, and then you're having a hard time communicating. That was part of the issue, communicating
Oh,
exactly what you're
yes.
feeling and
Yes.
that kind of stuff. So, yeah. Okay, ladies, let's stay on top of our vaginas and keep the balance of bacteria in there so that they're happy and that you don't feel them and you don't smell them. I love that. That's
Right.
that's like a
Proactive.
tagline.
We take care of our skin. We should take care of our vaginas.
Yes, absolutely. All right, any closing words and where can people find you and where can they find your products again?
So, my closing words, thank you so much for having me again. I love chatting with you. And my products are at Target and Walmart. We're on Amazon and at alubri.com.
Perfect. Excellent. And do you have a website or anything where people can reach? Oh, you have
Yep.
your
And then
Instagram.
you can see Alubri has social accounts that you can follow. And I have my Oh My Gyno,
Okay,
where I
and then
talk about
spell the name of
vaginas
the
all the time.
product again.
Alubri.
Okay, and your Instagram handle again.
Oh My Gyno.
Oh my God, no. Beautiful. Thank you, Nicole. If anybody has, Nicole's just a beautiful spirit to talk to. So check out her website, check out her products. And I hope that you have learned a little bit more about, your vagina today and how to look after it. Because, yes, my husband's over there. Yeah.
Hi.
Wow. You didn't want to hear that, did you? Anyway.
Oh.
Thank you very much. And listeners, please, share this information with like women need to know this stuff. So we all have vaginas. We all can learn a little bit about this. So share this. I think this was a really fun, relaxing episode, and really informative. So thank you, Nicole. It was a pleasure speaking with you again.
Thank you.
Oops, I gotta end the recording. Here we go. Bye, everybody.